and I'll be doing a demonstration on post-operative care for a patient who just had an emergency surgery. Hello, good afternoon. Yes, I am Aushkatolope and I'll be your assistant for today. So I'll be taking care of you now and I'll check your vital signs and everything first. Okay. So the first step in post-operative care of a patient that has done emergency surgery. For this patient just had appendectomy, which is the surgical removal of the appendix. So the first thing to do is to check the patient's vital signs. For example, you check the patient's temperature. So with this patient, so you keep it there. After you check, so you check the reading, and you see that the reading is not too high. So after you do that, you also check for the patient's pulse rate. So you check the pulse rate is checked per minute. So if the patient is actually normal, the pulse rate should be around 60 to 80 beats per minute. Anything more than that is tachypnea. Anything less than that is bradypnea. Okay. So this patient has 70 beats per minute. So this patient is normal. So we can also check for the we can also we'll also check for the patient's response. Please, do you know where you are? Okay, so the patient actually knows where the patient is, and we also check for the patient's pupil dilation. If both pupils they are dilating and they are responding to light. Yeah, so this patient's pupil is responsive to light. So after checking the vital signs and seeing that the patient is normal, the bandage and everything being used for the patient's for this appendectomy procedure, they are removed. It can be removed after 72 hours, and for 24 hours, the patient is not really advised to eat anything. Then after that, the patient can now eat. So you remove it carefully, so as not to affect the patient. So as not to affect the patient. Sorry. You just move carefully so as not to drag the patient's body with it. Sorry. So after doing that, you keep it in the waste bin, then you clean that position, that part. Once you have done you have removed the bandages, make sure that point is actually dry and clean, and check for if there's bleeding or any malfunctions there. So you check around, and if you see anything, you can take note of it. So after checking, after removing the bandages, and you make sure you don't put a bandage immediately. You don't put another bandage. You let it dry. The stitches that will still be there, you leave the stitches there. So the next thing now is to check if there is hemorrhage. If there's hemorrhage, the thing you do is you call the attention of the nurse. If the patient is thirsty, you ask the patient if the patient is thirsty. So if the patient is thirsty, it might be a sign of bleeding, so which can cause dehydration. So you ask the patient if the patient is thirsty. So if the patient and you also check for dryness of the lips or the skin. So you can give the person fluid that the patient can actually use. So after doing that, you also make sure you check for the patient's urine output. If the urine output is meant to be measured based on the patient's weight. So if the per kg, it is meant to be 1 milliliter per kg. So if you measure the patient and you know the patient's weight, so the right for this patient, now this patient is a 65 kg patient, the normal urine output you are meant to get should be around 65 milliliters of urine per hour. So I'll check what the urine output per hour. So it is actually around that range. So that means the patient is actually normal. So you take care of the patient now, and you ask the patient if the patient is feeling pains. If the patient is actually feeling pains, you can turn the patient's position, and you also check if the patient has actually had a stool. You check for the color. If there is blood in the stool, or if the patient has vomited, you check if there is blood there for cases of hematemesis, so you know if there are complications after the surgery. So this is how to perform post-operative care for a patient with